2 weeks ago, we published the first part of an interview with Roger Seheult, who's best known for MedCram. He just blows my mind over how much he knows and how well he knows it. One of his 4 board certifications is in sleep medicine, and Tony had just started asking him about it at the end of the last episode. Her first question was about blue light blocking glasses, and Roger's answer was,
does it actually beneficially help? There was a study that was recently published that showed it really doesn't help. So that's why I would say the best thing to do is not to have any lights at all. So on the other extreme, when you're in the morning time, you want to get exposed to bright light. One of these things that you can actually purchase is a dawn simulating light. So you plug it in, you put a timer on it, and it lights up as if the sun were warming up your room at 5:30 to 6 o'clock in the morning. Even though you may still be sleeping, even though your eyes may be closed, the effect of light in the room still penetrates through your eyelids. And actually, patients have noticed, and I talked to a young lady yesterday who told me after a day or so of using it, she noticed dramatic improvements in not only her mood in the morning, but also her energy. Wow. And that was just by simulating the sun coming in the morning time, even though she was sleeping.
Wow.
Yeah.
I've got a dog that takes care of that.
She said it was like drinking a cup of coffee without drinking a cup of coffee.
Yeah.
Yeah.
Okay, if it's really difficult to get rid of all the light in our bedroom, which it is our particular setup, what about wearing those eye things they give you on the airplane?
I think that's a great idea.
You know, put one of those on at night.
Yeah.
And then you're not getting any light at all.
Hopefully, yes.
And maybe that would help.
Yeah. These same principles that we talk about in terms of delaying the circadian rhythm and maybe even advancing it. So early morning light exposure, maybe an hour before you get up, can advance your circadian rhythm if you have a problem with being delayed. And of course, the opposite can happen if you expose your eyes to light at night after 9 o'clock. That can delay your circadian rhythm. And it's these very same principles that we use to treat jet lag. You can actually do the math a little bit. It's a little complicated, but when you travel from here to England, let's say that's 9 hours or 8 hours ahead of here, your circadian rhythm is still back here in the West, in the United States. And so you've got to sort of figure out where it is. And you typically, if you're going from here to England, you want to advance it. And so you want to stimulate and have light exposure to your circadian rhythm in the early morning hours this time, which you'll figure out over there is more like 2 or 3 o'clock in the afternoon. So getting out at 2 or 3 o'clock in the afternoon, when you reach London, that's really good at advancing. And then of course, you don't want to be exposing your eyes to bright light to delay it, right? Because delaying your circadian rhythm while you've advanced yourself is going to take longer for you to catch up with your jet lag. And so there are times where you really don't want to expose your eyes to light that are odd hours over there. Anyway, sit down, you do the math, you figure this stuff out, and
I'll ask Chris.
Yeah, and we actually put together a video on how to do this.
Is it on your MedCram?
Yes.
Oh, great.
Yeah.
I will get him to help with it because we're going to Africa.
Then you definitely want to watch this video. Things that happen in the human body are timed very specifically around the clock at certain times of the day. For instance, when you get up in the morning, this is when you have your sharpest rise in blood pressure. Then likely to have a bowel movement at around 8:30 or so. Highest alertness is around 10 o'clock. Best coordination around 2:30 in the afternoon. And the list goes on and on.
Oh, excellent.
And it's not based on my recommendations. It's based on a study that was done that showed that this protocol, which involves melatonin and avoiding light, can be 90% effective at reducing jet lag. So you can enjoy your stay there for more of your stay rather than trying to get over the jet lag.
I was just going to ask you. So I'm one of the people who can fall asleep quickly despite the room not being perfectly black. But then I wake up in the middle of the night, 3:30 say. So I've gone to bed 9:30 or 10, and I'm pretty regular with that, and I cannot go back to sleep.
Yes.
But I'm tired in the morning thinking, shoot.
So I can't tell just based on that exactly what the diagnosis is, but I can tell you there are certain things in my mind that come up that it could be.
Okay.
So one thing that it could be is that, for instance, that your circadian rhythm is significantly advanced, but you go to sleep at an hour after you feel sleepy because it's socially acceptable. Maybe your husband goes to sleep at that same time.
Yeah.
Let's say that your circadian rhythm, instead of you saying that you go to sleep from 10 p.m. to 6 a.m., your circadian rhythm is more like 7 p.m., to 3 or 4 o'clock a.m. But you don't fall asleep at 7, even though you're dead tired, because socially it's not acceptable. So you do go to sleep eventually, but then your circadian clock says at 3 o'clock, okay, we're done.
We're done.
Yeah, so you wake up. So in that situation, and it's not uncommon for older people to have it.
A lot of my friends have the same situation.
Yeah, absolutely. It's
we're all
not
talking
uncommon.
about it. We're all saying, we could call each other and have a conversation at 3:30.
And adolescents have the opposite problem. So they tend to go to bed late and try to get up late. You know, teenagers sleep till 10 o'clock, 11 o'clock.
Yeah.
It's not that they're lazy. It's just this is a natural thing that happens to their circadian rhythm. And it kind of bounces back to regular when they hit regular adulthood. But then, you know, as we're saying, as you reach an older state, it tends to become more advanced. So it could be that your circadian rhythm is advanced. So one thing that you could do to delay it would be to expose your eyes to bright light at 7, 8, 9 o'clock at night on a routine basis to see if it would become more delayed.
More delayed.
Now, if you were to tell me, but doctor, I don't feel sleepy at all at 7, 8, 9 o'clock, and I just feel sleepy at 10 and I go to bed, but I still wake up at 3. Well, then I would say that it's possible that you might have obstructive sleep apnea.
Okay, I've been tested for that.
Okay.
Have very mild.
Okay, so I would like to look at the details of that, and I'll tell you why. How they determine something is mild is they look at all of the hours that you are asleep, and they add up all the times you stopped breathing. And if the number of times that you stopped breathing divided by the number of hours that you slept is between 5 and 15, that's mild. Now, the reason why I say that is because it's not uncommon. I've seen this actually quite often, especially in women, that when they go into REM sleep, that's when they get the worst type of obstructive sleep apnea. Let me explain. REM sleep is a type of sleep where you become paralyzed. And it's important that you become paralyzed because you go into a dream state and you don't want to be acting out those dreams. Unfortunately, you become paralyzed, but your neck muscles also become paralyzed. So if this is your airway when you're awake, and this is your airway when you're asleep, and you're asleep and not in REM sleep, you're doing fine. You've got no obstructive sleep apnea, air is going in, air is going out, no problem. As soon as you go into REM sleep though, that muscle becomes even more relaxed. And now you've crossed the threshold, and now you have terrible obstructive sleep apnea because you're in REM sleep.
Ah, okay.
Okay. And as a result of that, when you're in REM sleep, you'll get potentially frequent obstructive events. Well, as it turns out, REM sleep typically occurs later on in the evening, later on in your sleep. So early morning hours, 3 o'clock, 4 o'clock. And so what will happen is that you'll go through the sleep study, you'll have no events until 3 or 4 o'clock in the morning, and then you'll have terrible events associated with REM sleep. It will wake you up because you've obstructed and you've aroused and you've woken up. But when they look at the total events over the hours that you have been asleep, it's below the threshold of sleep apnea. And so the current recommendations and reimbursement guidelines from the insurance companies would not justify you getting a CPAP machine for your sleep apnea, but yet you're hopelessly sleep apneic whenever you go into REM sleep at that part of the night. And that's hard to do just by looking at the report. I would have to look at the study and actually see what happens. So in those types of situations, if someone is having difficulty with sleep and they're continuously waking up at that hour, I would try them on a trial of CPAP to see if that solves the issue.
I've had a CPAP for 6 years.
Okay.
And
still waking up.
Similar problem. My mind is racing.
Yes.
And I've tried breathing and meditation and getting out of bed and reading a book for a while. I've tried those things and taking melatonin and various time-release melatonin.
Oh, okay.
And all those sort of things.
So melatonin, do you take melatonin at 3 o'clock in the morning or melatonin at 10 or 11?
The night before.
Oh, okay. Like what time? Like
about 8:39.
Okay, that's reasonable. How much?
Just one tablet I think it's 5.
That's reasonable. I wouldn't go much above 5. Melatonin tends to advance your circadian rhythm. So be careful. Yeah, and melatonin at night tends to advance it.
So should I maybe not take it?
Yeah, and it's also very short acting. It's probably not going to solve your problem at 3 o'clock in the morning.
Even the time release one?
Maybe not.
Okay.
Yeah, maybe not.
Try without it.
Yeah.
I remember now the sleep, I just had the sleep test and it was a 4.
Yeah, so you didn't meet the criteria.
I
It'd
didn't meet
be
the
interesting to
criteria.
know if you were to go back and look at that study, what I would recommend doing is looking at the REM-related AHI.
Okay.
So what was your AHI? What was the number of events exclusively during REM sleep?
Okay.
Yeah, and see what that is.
And so since the CPAP didn't seem to help me at all over all those years, and I was very religious, I used it every night.
Yeah.
I was, so I was good. I'm wondering about dental appliances. Do you know anything about dental
Absolutely,
appliances?
yeah. So this is the airway, when you're awake. This is the airway when you're sleeping. And the airway starts to encroach anterior posteriorly, come narrow together. Part of that problem is the tongue. And because the tongue is attached to your lower jaw, if you were to move the lower jaw forward, because this is a synovial joint, it's got a little bit of movement, then as the lower jaw moves forward, the tongue may also move forward and off the back of the throat, which is often where the obstruction is. So wearing a dental device and you can kind of simulate this even now in real time, if you put your two incisors on the bottom in front of your two incisors on the top, like this, and you can even help by putting two fingers behind the angle of your jaw like this. Now try to snore. It's impossible, because what you've done is you've brought in all of the...
everything's, forward.
Everything is forward, and so you've got an open airway.
Ah, okay.
Yeah, now try to snore without doing that.
Oh, I can do that really well.
Very easily, yeah.
So I know there's two options. There's the over-the-counter one that you fit to your mouth by putting in boiling water, and and then there's going to a dentist and having them create one.
Correct.
Do you have any experience with either or?
I have a lot of experience with the dental one, because that's the one that I recommend. I don't recommend doing the boil and bite.
Boiling bite,
yeah.
Okay.
And the reason is that it doesn't fit as well, and it can change.
Okay.
The dentists now, in the old days, they actually used to put stuff in your mouth to make impressions, and then pull out the impressions and make the dental device on that. Some still do that. That's perfectly appropriate. They actually have new technology now that uses visual sound waves and things that map your teeth. And without even doing a dental impression, they can make a perfectly fitted one that you can put in your mouth without a problem. The important thing to have, though, is it to be manually adjusted. So you can put different bands on, or you can have it adjusted so that the jaw comes out at different intervals. Because what they want to do is they want to bring it out enough to make the sleep apnea, but not so much that they cause problems with the joints, or even moving the teeth, right? So you're using your teeth as traction to move the jaw out. You may actually start to move teeth when you do that. So you have to be careful with that.
And how about the pillar surgery?
Is that the one where
they put little rods in?
Yeah, that one has not been as
I haven't had anyone recommend it to me.
Yeah, no, I don't. Not as promising. The one that's actually all the rage now is the one where you see the commercial where they throw the CPAP away and they say, "I don't need the CPAP anymore."
If you struggle with CPAP, you should check out Inspire.
Honey?
Inspire, sleep apnea innovation.
And it's the same basis of what we're talking about with the dental device. So it's trying to get the tongue off the back. So instead of using the jaw to move the tongue off the back, what they do is they contract the muscle to move the tongue off the back.
The device is implanted in the chest wall just like a pacemaker. When sleeping, the device is turned on and constantly monitors for any breathing attempts via a sensor attached to the chest wall. When a breath is detected, the device sends an electrical pulse to the hypoglossal nerve, which in turn stimulates the tongue muscle to move forward, resulting in a more open airway.
And that muscle is called the genioglossus muscle. It basically attaches this tongue to the inside of this muscle, of this bone. And so when that contracts, the tongue comes up. Well, the nerve that does that is called the hypoglossal nerve. It's the 12th cranial nerve. And so if you just put an implant here, which has a sensory wire that detects every time you take a breath in, it will send a impulse signal to the hypoglossal nerve and cause the tongue to contract. And so your tongue basically moves anteriorly during sleep every time you take a breath.
That sounds a little scary.
Yes. Well, it isn't. It's certainly more invasive than the dental device or the CPAP
Right.
machine. It's FDA approved for people who have moderate to severe sleep apnea.
And I don't have that.
Yes,
so
you don't have that. And a BMI of generally less than 35. Some will even
I
say
definitely have that.
less than 40 in some situations, but generally less than 35.
Yeah, I have a low BMI. So
Yeah, yeah.
not worrying about
And
that.
then the other thing that they have to check is they have to put you to sleep with sedatives to see what happens to your airway. Some people's airways close circumferentially, and this would not be helpful in that type of a situation. Most people, about 80% of the people's airway closes anterior posteriorly, in which case this would be a potential solution to that problem.
Okay, great.
Yeah.
Thank you.
Yeah.
That's fantastic. So, yeah. Okay. So I don't know. I'll keep I'm working on my brain, meditation, mindfulness, all that sort of stuff to calm myself down to try to get back to sleep.
Try writing down the things that are going through your head. It gives you permission to write those things down and then be saying, I'm going to pick those up in the morning. It's okay if I stop thinking about it.
Oh, okay.
Yeah.
So some people are reluctant to wear masks. Are they that effective? If they're, say, a good mask, an N95 or something like that for COVID?
Yes. So there's a lot of data surrounding masks and things, and a lot of the data. In fact, the Cochrane review just did something on this a little while ago to look to see if it was, and they found that they just couldn't find enough good data to be able to say whether or not the masks work, which is not unusual when you're dealing with very heterogeneous data. A mask is a tool, and unfortunately, sometimes it can be used in the incorrect way. And if it is, you're not going to get the data points that you need. But we know based on the basic science that viral particles like SARS-CoV-2 travels in droplets. Those droplets can be suspended in air and can travel as airborne droplets, or they can be spit out and they can be formed as contact droplets. Regular surgical masks are very effective at reducing those types of contact droplets. That's why they're used in influenza and things of that nature.
Just little blue ones.
Yes, the little blue ones.
That don't look that fancy.
That don't look that fancy. N95, on the other hand, are the types of masks that we would use not to prevent us from spreading it out like a surgical mask would. As you may know, if anyone who's worn an N95 mask will know that when you blow out, the air escapes from all over the place. It's designed to do that. N95's masks do not filter stuff that you breathe out. N95 masks filter stuff that you breathe in. And that's the important part. And the particle size there is small enough that aerosolized droplets in the air are not able to go into the mask and to breathe. This is why these are the types of masks that we use if I were to go into a room where a patient had tuberculosis, which is spread by airborne, same as SARS-CoV-2. I would be wearing an N95 mask. If I wasn't wearing an N95 mask and I was in there for a significant amount of time, I would be required to test for tuberculosis 6 to 8 weeks afterwards. And that's because the N95 mask gives us enough protection to protect us from something that's airborne like that, like tuberculosis, also similarly with SARS-CoV-2. So to give you an example, when I was treating dozens and dozens of patients during 2020, 2021, I was wearing an N95 mask. This is for a whole year before I had the vaccine. I never contacted or came down with COVID-19. The irony was I was actually safer in the hospital, taking care of those patients with unlimited, well, there was a little bit of a limitation, but practically an unlimited supply of PPE, personal protective equipment, N95 masks, gloves, double gloves, gowns, all the things that we absolutely needed. And so I never got COVID. In fact, the people who did get COVID that I worked with at the hospital had picked it up when they went and did sort of clandestine parties or went out and saw other people. That's where they picked up COVID-19. There was no people picking up COVID-19 in the hospital. Yeah.
Because you were being so careful.
Very careful. Yeah.
So if I had a cold and didn't want people to get it, it would be good to wear a surgical mask. But if I knew someone had a cold and I didn't want to get that cold, then I would wear an N95.
N95,
maybe.
yes. And actually, N95 is going to be far more effective than a surgical mask in that case. But even a surgical mask can be effective. There was a study that was done on a Japanese airline for the vaccine. I think we covered this on our Masks on a Plane video. and it showed that somebody had flown on an airline with a destination in Asia. I think it was Tokyo, if I'm not mistaken. And it showed that the people that came down with COVID after when they did tracing were sitting around the person, and those that were wearing even regular surgical masks, because they didn't distinguish between surgical and N95, were protected from getting that type of thing. And just realize, of course, on an airplane, since we're bringing it up, the air filtration system now, ever since COVID, has been upgraded to N95. All of that air, 50% of the air every time gets recycled. It gets recycled through several times. The air coming down from those vents are absolutely devoid of SARS-CoV-2, and the circulation in there is actually very good.
So I don't have to wear it on the plane to Africa.
Here's the key. So long as that air is circulating, you're probably okay. The problem is when you're sitting on the taxiway and that air is not blowing, or if you take your mask off to eat. Those are potential weak points in the link.
But if I took it off and the air circulation was still good in the plane,
you're probably
circulating, probably fine.
Based on the data,
taking it off to eat is probably safe.
Yeah.
And I would wear it in the airport, say.
Yes.
And waiting in line.
Airport is much higher risk than flying in a plane with the circulation going.
Okay.
Absolutely.
Right.
Yeah.
All right. So my question for you is, what's next? What are you working on?
Well, we're working on trying to actually make more educational videos again. One of the areas that I see in the hospital that people need to know more about, I think, is the management of lung collapse, chest tubes, pneumothorax. These are things that are seen quite often. So we're actually right now making a course for that, and hopefully we'll be publishing that soon. In terms of our YouTube channel and what's going on, I see potential topics coming up. Obviously, the H5N1 is a emerging issue, and we're seeing potentially more issues there as we start to see more and more cases and the vaccines coming out for those. We're starting to see infectious diseases in general going up. We have dengue fever, which is very highly prevalent now in Puerto Rico. And this may be a bad year. Hopefully it goes back down again. Also, this topic that we're talking about with light and nutrition, diet, these are all areas that I think the public is interested in and probably deserves to get some more information about. And of course, photobiomodulation. I think that's an area that I think is so incredible. The benefits of getting outside and getting light, and then making sure that we're clear that we're not necessarily advocating to go out and buy these devices, because one of the things that I think I'm kind of a mission is, in terms of where I'm coming from, is I want to make sure that we're pursuing things that are healthy, but that are scalable and don't require a supply chain. I believe that that's really important. If we were in a pandemic, one of the things that concerns me, even today, we have issues in the hospital with trying to secure medications. There's always drug shortages. But in a pandemic situation, the ability to get good quality medications, especially medications where the public has a perception are effective, it's going to be almost impossible. Let me give you an example. I remember trying to secure hydroxychloroquine for my lupus patients. It was impossible because there was this idea, this understanding that it may be beneficial. So if we are completely dependent on medications, vaccines that are supply chain dependent, and we're in a situation where we have an H5N1 pandemic, which potentially could have a 30% mortality, the first thing that's going to go down is supply chains. The first thing that's going to go down is our hospital infrastructure. And if we want to treat people effectively, we can't be dependent on those types of things. So what's really important for me is understanding some things that are easily graspable, that are not supply chain dependent, that are inexpensive and available to a wide population. Things like hydrotherapy, things like these sorts of things that we've been talking about.
Yeah, and misinformation, as you noted, is just absolutely rampant online.
Absolutely.
How do you combat that best?
I think the best way to combat that is, instead of trying to attack it directly and just argue with them, it's like, no, you didn't, yes, I did, no, this type of back and forth, is to simply show the evidence and show the data and why this is the way things are. Eventually what happens in most cases is either they're convinced because data is data and data doesn't have an agenda, or what they do is they say that the data is corrupt in which case you're no longer playing the same game, right? It's like you're playing the soccer game and then you find out that you don't need to kick it into the goal to make a point. Then you're no longer playing soccer. So it's like, so I deal with data, I deal with evidence, and once they want to corrupt data and evidence, then we're done. Yeah.
Nice.
That's basically how. So if they want to work in the world of, figuring out motives and intentions and where things are going and why things are happening, you can play that game all day. I think the majority of the public appreciate physicians that know that they care and that are, they're not in this just to make money and do all of these sorts of things that you see often. People that have had a reputation for following the data and making recommendations from there so people can be healthy.
Okay, and last question.
Yeah.
You have a pretty sizable following now. Are there things that you wish you could bring up on your YouTube channel that you can't because it's just too controversial or otherwise?
Not as much. At the very beginning of the pandemic, I think I really wanted to talk about, the evidence for hydrotherapy, the evidence for sunlight. And I think that I started off with probably the less controversial ones first. And the first one that we brought up was sleep. And who's going to argue with sleep, right? And so we started to show that there are some very basic things that you can do. And we actually showed the research for how it actually is beneficial. For instance, we showed a piece of evidence that showed that if you get 7 hours of sleep the night before your vaccination for the flu, your antibody response is almost twice than it is if you don't get 7 hours of sleep. That's a big difference, like twice the amount of antibodies. But yeah, no, I think all of the things that we bring up on our channel are there. I try to avoid controversy that is unnecessary. Because I think that it distracts. But I'm not afraid of controversy if it's in the pursuit of truth.
That's awesome. And then one real last question that just came to me that I remember my friend asked me to make sure I ask you.
Yeah.
Is you seem to have just one video on your channel which addresses the efficacy of a vegan diet, or maybe two.
Yeah.
Would you say that a whole food, plant-based vegan diet is perhaps the most beneficial one for human health, or is it difficult to say?
I believe so. Yeah, I believe so. We've talked about this actually on a number of occasions. We have one where we talked about the low carb fallacy, where we talk about how not all carbohydrates are the same. The carbohydrate load from juice versus the apple that it came from, very different in terms of fiber. We talked about in the one on meat and the sialic acids. That was a large video where we actually incorporated the Biobank study from the UK talking about processed versus non-processed foods. So it's there. I'm willing. I think we've done at least 3 or 4 videos.
Yeah, and immunity being enhanced.
Absolutely. There's certainly a lot of channels out there that push a carnivore diet and have a perverse reimbursement from that. I'm not sponsored by. One of the things that I think I come from in that is that I don't sell anything.
Well, what about MedCram? You sell courses,
yeah,
right?
the courses to right. So we sell courses to professionals for their professional fees, but we don't sell, recipes for vegan food. We don't sell supplements, and that's not to say that we haven't been approached. I've had people from the nutrient supplement industry that wanted us to, push certain supplements and things. We said no. We're out there looking at the data. What motivates us is to find the truth in terms of the health for the people that watch us and to cut through. We want to be the ones that people go to find out what's the truth. What does the science say? Because we know that MedCram isn't being paid either by the nutraceuticals or the pharmaceuticals or by a product that needs to be pushed or anything like that. The only way that we make money is by people coming to our website who need continuing medical education and buying our courses.
That's awesome. Yeah. Thank you so much.
You're welcome.